Some risk factors for type 2 diabetes, such as a family history of the condition, age, and race, may be out of a person's control, but people do have control over other risk factors, including diet. I'm Erin White with your latest health news. A recent study found that people who improved their diet had a lower risk of type 2 diabetes than people who made no changes to their diet. The researchers discovered that a better diet reduced the risk of diabetes regardless of other diabetes risk factors. Eat a healthy diet to lower your diabetes risk.
Positive change in the health of Americans is always welcome news. New research suggests we may have something to celebrate in terms of strokes in the U.S. I'm Valerie Cavett with your latest health news. A stroke occurs when blood flow to the brain is reduced due to a blockage in an artery or bleeding in the brain. The study examined a large sample of American adults from 1987 to 2011. Data from this sample was then used to estimate long-term health trends. The study found that the rate of strokes and death from strokes declined during the study period. According to the authors of this study, strokes are a leading cause of both death and serious disability in the U.S. Exercise regularly to help reduce your risk of stroke.
If you're a parent, you've undoubtedly had some questions about childhood vaccines. Namely, are they safe? I'm Rochelle Grossman with your latest health news. The latest medical review funded by the U.S. Department of Health and Human Services found that immunizations for children overwhelmingly offer more benefits than risks. Researchers found a few serious side effects, including seizures resulting from high fevers after the MMR vaccine and a bowel condition associated with the rotavirus vaccine. They say if you have questions, you should discuss vaccinations and their safety with your child's pediatrician.
Women with a certain type of breast cancer may be prescribed a medication called tamoxifen to slow the spread of cancer. However, in some women, tamoxifen causes harmful side effects like blood clots. A similar medication may lead to fewer such side effects. I'm Mindy Cook with your latest health news. A recent study found that a product of tamoxifen in gel form worked as well as the oral form with fewer cases of blood clots. While other side effects that are experienced with the oral form still affect patients using the gel form, doctors will continue to research in hopes of discovering that the gel form is capable of both lowering the risk of blood clots and the growth of tumors. If you have breast cancer, discuss treatment options with your oncologist.
Prescription medications are familiar to many people in the United States, but just how common are they and which types of medication are we mainly using? I'm Sonia Singh with your latest health news. A new report by the Centers of Disease Control and Prevention, or CDC, analyzed the use of prescription meds in the U.S. The report showed that during 2007 to 2010, almost half of Americans had used a prescription medication in the past month, and many of these Americans were using said medications for heart-related issues and cholesterol levels. Speak with your doctor to learn more about the appropriate use of prescription medications.
Here is some good news for Americans waiting for a kidney transplant. Older adults who donated kidneys were not at an increased risk for heart problems, kidney disease, or dying. I'm Miranda Savioli with your latest health news. A newly published study from the University of Pennsylvania found older kidney donors did not have a different survival rate when compared to non-donors. There was no difference in rates of heart and vessel disease between the two groups, nor was there an increased risk for diabetes, low thyroid function, or osteoarthritis for older donors. However, older kidney donors did have a 53% greater chance of being diagnosed for non-melanoma skin cancer. But the study's authors feel this may be because donors might visit their doctors more often. Speak with your doctor if you are considering a kidney donation.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby Cullinan with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Summertime brings sunshine and warmth, but also mosquitoes and attempts to ward them off. Many people might wonder whether insect repellents with DEET are safe. I'm Erin White with your latest health news. DEET stands for N,N-diethylmetatoluamide, a compound shown to be effective in warding off insects. A recent study found no evidence of negative health side effects related to the use of DEET at the recommended levels. Take steps this season to prevent mosquito bites.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby Cullinan with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
About 1.5 million people around the world are currently on hemodialysis, an artificial blood filtering treatment for kidney failure. This treatment is known to impact patients' physical function, but they may have more control than they realize. I'm Erin White with your latest health news. A recent study found that hemodialysis patients with more muscle mass had better physical function compared to hemodialysis patients with low muscle mass. The researchers suggested that physical activity that builds muscle mass may be associated
associated with better overall health and quality of life for hemodialysis patients. Discuss an appropriate physical activity regimen with your doctor.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
Parkinson's patients often deal with tremors, stiffness, and slow movements. In addition, a recent review found that Parkinson's patients are also likely to experience sleep problems. I'm Miranda Savioli with your latest health news. As many as 70% of Parkinson's patients have problems falling asleep, staying asleep, or experiencing daytime sleepiness. They may also have REM sleep behavior disorder, where they act out while dreaming. Additionally, medications used by Parkinson's patients can worsen these problems. The authors recommended that Parkinson's patients get screened for sleep problems by their doctor, as tiredness can worsen conditions like unsteadiness. Researchers noted sleep disorders can actually help diagnose a patient with Parkinson's earlier on, which may help the patient handle the disease better in the long run. So, see a doctor if you are having sleep problems.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor.
To get the best in trusted health and medication information, join us at rxwiki.com. Sign up for the rxwiki.com newsletter by going to rxwiki.com and clicking subscribe on the right side of the RxWiki homepage to receive the latest health news and videos delivered in a consistent and easy-to-understand language. rxwiki.com, for patients by pharmacists.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
Electronic cigarettes, or e-cigs, are often marketed as a healthy alternative to regular cigarettes. But are they? I'm Rochelle Grossman with your latest health news. New research is questioning whether people are really aware of the effects e-cigarettes have on their health. In fact, a new study discovered that many people didn't even know if e-cigs were harmful. The study found that those most likely to have tried an electronic cigarette were current smokers, people between the ages of 15 and 24, and those who had previously attempted to quit smoking. The researchers concluded that e-cigarette users should discuss the potential risks of smoking e-cigs with their doctor.
At one point or another, almost everyone gets constipated. Fortunately, most cases can be resolved with simple changes to diet and exercise. Sometimes, though, constipation can lead to complications. I'm Erin White, and this is a health feature. Constipation is a condition in which a person has fewer bowel movements than usual. In any given person, there may be several causes for constipation, including a lack of fiber, not drinking enough fluid, an inactive lifestyle, and changes to one's environment. However, constipation may also be associated with a more serious condition, such as diabetes, scleroderma, thyroid disease, multiple sclerosis, or Parkinson's disease. In most cases, constipation is acute and not likely to cause serious problems, but it can still cause complications. These may include hemorrhoids, anal fissures, rectal prolapse, and fecal impaction. Treatment options vary depending on the cause, severity, and duration of the constipation. Fiber-rich food is necessary to normalize and maintain bowel function. Reducing the amount of refined and processed foods, such as processed meats, cheese, and ice cream that you consume each day may also ease constipation. Instead, choose foods with natural fiber, like vegetables, fruits, beans, cereals, and breads. Exercise daily and ask your pharmacist if your medications can cause constipation. If so, talk to your primary care doctor to see if a change to your medication, or stopping altogether, is right for you. In severe cases, surgery might be needed. Biofeedback, a method that can be used to retrain the anorectal muscles, may be another possibility. Eat plenty of fiber, exercise daily, and speak with your doctor about any constipation issues you may have.
A woman experiences a variety of changes to her body while she's pregnant. While these are normal changes, they might influence her alertness or the way she's feeling occasionally. I'm Shelby Cullinan with your latest health news. If any person is feeling tired, nauseated, or otherwise not well, it may increase their risk of an accident while driving. A recent study found that pregnant women who may feel fatigue or nausea more often than usual had a higher risk of a car accident while driving in their second trimester compared to their risk while not pregnant. Be alert and follow traffic laws while driving.
Taking prenatal vitamins is important for pregnant and breastfeeding women, but even these supplements may not give women enough of one crucial substance. I'm Kendra Rowland with your latest health news. A recent statement reviewed the importance of adequate iodine intake for pregnant and breastfeeding mothers. Many women do not get enough iodine, which can be found in yogurt, milk, iodized salt, shrimp, lobster, and other foods. Doctors recommend that pregnant and breastfeeding women take daily supplements of at least 150 micrograms of iodide. Ask your OB/GYN about taking iodine supplements.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber.
One of the scariest moments for a parent can be seeing their child hit in the head, especially if that hit is hard. If they sustain a concussion, it's important to know some guidelines for recovery. I'm Mindy Cook with your latest health news. Guidelines were recently published to help doctors in diagnosing and treating concussion injuries in children, but the information is valuable to parents as well. Red flags to note following a concussion involve neck pain, confusion, irritability, repeated vomiting, severe or increasing headaches, and unusual behavior changes. The published guidance suggests taking your child to the hospital if you notice these symptoms. A doctor should give advice on how to manage sleep, fatigue, and social interactions. Rest your mind and body while recovering from a concussion.
Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. While the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer, researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with a doctor about your COPD symptoms and medication that is safe and effective for your condition.
The risks of smoking can extend beyond your own health and that of the individuals breathing the secondhand smoke. They may extend to your children's choices as well. I'm Shelby Cullinan with your latest health news. A recent study found that teens were increasingly more likely to smoke with each extra year their parents smoked since the kids were born. Even if the teens were not regular smokers, they were more likely to experiment early on with smoking for each additional year their parents lit up. Quit smoking before having kids.
If you have allergies, you know your symptoms can change during the day. And based on new research, there might be a pattern to when your pollen allergies are at their worst. I'm Rochelle Grossman with your latest health news. A team in Denmark found there may be specific times when allergy sufferers should stay indoors, and those times change. The research found the early season displayed two peaks, in the morning and evening. The mid-season pollen count spiked once in the evening, and the late season peak came in the late morning into early afternoon. Keep up with your local pollen count forecast to work with the change in peak hours and talk to your doctor about managing seasonal allergies.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.